Hello and welcome to Take Your Medicine. I hope that you all are doing well. On today's show, we'll be talking about medication used in the treatment of depression. The drug classes we will be discussing include serotonin and norepinephrine reuptake inhibitors, atypical antidepressants such as tricyclic antidepressants, anxiolytics such as benzodiazepines, and antipsychotic medication. The first class we look at are the selective serotonin reuptake inhibitors and the serotonin norepinephrine reuptake inhibitors. These drugs help in the prevention of reuptake of the neurotransmitter chemicals serotonin, norepinephrine, and dopamine. So to better understand this, I want you to imagine yourself standing on the shore of a beach. Now you have your feet planted into the sand. Now think of the sea as your brain and a wave as a brain releasing these feel-good chemicals, serotonin or norepinephrine or dopamine. The wave crashes on your feet, which represents the receptor which will elicit a smile or a feel-good sensation. But once the wave crashes, it starts to go back into the sea. Just as the feel-good hormone will be taken back up into the brain. So these reuptake inhibitor drugs will act as you holding an empty bucket to catch this water from the wave and slowly pour the trapped water on your feet so that you can feel better for a longer period of time when compared to when the wave just crashed on your feet and within seconds went back into the sea. This is basically what these drugs do. Now by making you feel good and uplifting your mood, your body will be in an excitable state, meaning you will feel the effects of these feel-good neurotransmitters for longer, which then can lead to other side effects. Now think of how you feel when you're excited, and this is the type of side effects you may experience, which can include insomnia, dry mouth, an increase in heart rate, anxiety, and excessive sweating, to name a few side effects. If you're on this class of drugs, please avoid stimulants like high amounts of caffeine or high doses of multivitamins that include caffeine or herbal stimulant medication, as these can increase the side effects of these drugs. The next class we will be looking at are the tricyclic antidepressants. These were one of the first classes used to treat depression. They work similarly to SSRIs, but they tend to focus more on the norepinephrine neurotransmitter than the serotonin. Common side effects seen with these medications are drowsiness, blurred vision, constipation, dry mouth, urinary retention, and tremors. They are usually taken at bedtime as to limit the side effects you would feel while using them. Use of tricyclic antidepressants have diminished over the years with the introduction of newer drugs with less side effects. An example is Amitriptaline. Another class I see being used is benzodiazepine drugs. Now benzos, as we call them, are used to treat anxiety and sleeping problems and commonly prescribed with other antidepressant medication that counter the side effects of other stimulant classes such as the SSRIs. They work by increasing a chemical called GABA, which is gamma amino butyric acid. GABA reduces brain activity in certain areas of the brain. The main effects of this medication are sedation, reduces anxiety, and causes muscle relaxation. Therefore, side effects of this medication include drowsiness, sleepiness, memory loss, confusion, and it may increase the risk of depression if not used correctly. Please avoid alcohol when using any antidepressant, but especially benzodiazepines, as it can really increase the effect of the side effects you can experience. An example of a benzodiazepine is Diazepam. Next, we look at some antipsychotic medication that's been shown to enhance the effects of an antidepressant when an initial response to antidepressants is poor. Common drugs used are Quetiepine or Aripiprazole, which are used together with an SSRI. It's been shown to be effective in treating depression in bipolar patients. Lithium carbonate is also used for its mood stability effect. Again, we see it mostly when treating a patient who suffers with bipolar disorder. There are some other classes that we didn't discuss, but many of these drugs work by having an effect on the serotonin, norepinephrine, or dopamine neurotransmitter directly or indirectly in the brain. I hope that now you guys are more informed on how antidepressants work, and if you liked today's episode, then please hit the like button, as this would increase the chance of the YouTube algorithm showing this video to more people. Also, don't forget to subscribe to the channel and hit the notification bell to alert you to all upcoming episodes. Thank you guys for joining me. Take care. Goodbye.